So now if you go into, like you mentioned, the tinctures and having to hold that in your mouth for a long, long period of time, well, what are you really getting out of it versus the Trokie administration, I think is probably the most ideal. In my mind, it's the most ideal administration.
So the idea with a product like Trokie is that you get really consistent dosing. So it's a lot easier to titrate dosing. And then you can take the same dose over and over again and get the same effect. So I think that's a great point to make. That's the discussions we have with our clinicians and patients.
It's important to recognize that phytocannabinoids in an individual generally will be biphasic in their activity. At a low dose, they're going to get a physiologic effect, which is generally beneficial. And at a higher dose, they're going to get a physiologic effect, and it can be beneficial or not, depending on the type of product and the content of the phytocannabinoids.